Welcome to this Medical Appraisal Skills video workshop. This is one of a series of short films intended to explore some of the challenges presented by medical appraisal conversations, and to encourage you to consider helpful behaviours, strategies and mindsets for these important meetings. The purpose of this film is to explore how we can encourage doctors to reflect on their practice and use multi-source feedback to help create a personal development plan. We join our doctors mid-appraisal. So you're 5 years into your career as a consultant.
That's right.
I can see you've got a really wide range of interests. You spend a lot of time outside of the trust. You're rapidly becoming known as an expert in your field. Tell me some more about your private practice.
Well, it's thriving. I have patients here in the UK. I also have patients overseas. And it's very valuable to me. I'm being commissioned to write chapters for many publications these days. So to see a wide variety of patients is very useful.
Okay, great. So quite a lot going on.
Indeed.
The writing commissions must take a lot of your time up. How do you divide your time?
Well, I'm just very sensible about it. I have my patient lists, but I also spend a lot of time at conferences and meetings. They can be here, Europe, the US.
Okay. What's the impact of the travel, of the time away out of the country on your NHS work?
I think it's negligible. If anything, it's positive. As I build my reputation, as I become a leader in the field, I think I become even more valuable to the trust. Bariatrics, as you know, is a very young surgical area for the NHS. So to have somebody with my calibre, I think is very important.
Okay, this is interesting. What this doctor's telling me sounds great and very plausible. And at the same time, there's something missing, because I've noticed in her multi-source feedback that a number of her surgical team, her colleagues, have reflected on the strain that's being put on them by her absence. Now, at the moment, it doesn't sound like she's willing to or able to recognise or acknowledge that, and I'm wondering what I can do to raise this. What would you do? Take some time now to discuss your options. Something you might have identified is that our doctor may have a blind spot here. Given that this may be the case, what could you do to explore this possibility? Let's see how our appraiser checks out the doctor's awareness around this.
So, as you know, bariatrics is a very young surgical field within the NHS. So to have somebody of my calibre on the team for the trust is really important.
Yeah, I can absolutely appreciate that. Your reputation will be something that reflects well on the trust.
Yeah, exactly.
Yeah. I think another consideration around this is some of the information that's contained in your multi-source feedback. Have you had a chance to have a read of that?
I've glanced through it. I haven't looked at it in detail, to be honest.
Okay. And what were your reflections based on what you have seen?
Well, I noticed a few comments around frustration of my colleagues, which I find very odd. I haven't had those conversations directly with those individuals. So I think it's a slightly obtuse comment.
Okay, all right. So say some more about. You said you found those comments very odd.
Well, I think if somebody has an issue, you talk to them directly rather than wait for some paperwork to come around. So, yes, I would like to think that my colleagues could talk to me directly. I feel I'm a very approachable person and very fair. So I'm disappointed with that.
All right. So approachable and fair.
Yes, I think so.
In that case, what do you think might be behind the fact that your colleagues haven't had those conversations with you that you'd have liked them to have?
Well, if we assume that they are assertive individuals who would want to talk to me, I don't spend a lot of time just sort of hanging around waiting for conversation. So yes, I am a very busy person, so I might be difficult to track down occasionally to have a conversation with.
Okay, yeah. So I guess the fact that when you're in the trust, I imagine a lot of your time is spent with patients.
Oh yes, I'm patient-facing whenever I'm there.
Yeah, all right. So that could be contributing.
Possibly.
Connected to this, I also noticed that your post-op complication rate is higher than
Yes.
the rest of the team. What might be behind
Yes,
that?
I make no apologies for that. I get the difficult patients as I'm the most experienced on the team, so I don't think that's surprising or worrying in any way.
Absolutely, that might well be part of the explanation for that. I'd really encourage you to reflect on whether what we've discussed in terms of the time you spend away from the trust might also be being reflected in your post-op complication rate. So in other words, if you're not around to plan and to review your surgery, then that might be what we're seeing here.
There might be an element of that. I'm relying on the team for post-op care, and obviously they're relying on my patient notes, which occasionally won't be as up to date as they would like them to be. So there may be an element of that.
Okay. So there's something about your notes not being up to date, your written work.
Yes,
Yeah.
I'm busy. I input what I think is essential, which other people might want more information than that.
Okay. And that's one aspect of communication with the rest of the team. I was wondering what other thoughts you had around other ways you might communicate with the team.
Well, obviously talking to people, but as I've already alluded to, I don't have time for chatter. I'm happy to talk to the members of my team, but I have a busy and very full schedule. So yes, it would be good to have more conversation. I would think.
Okay, great. So I think if that's the case, if you'd like to be able to have more conversation with the team, my suggestion to you is that you carve out some time in your diary to set up some meetings with your team.
Right. Okay.
To start to talk about how you can use your time when you are in the trust more effectively. You might also want to consider how you can work more smartly. So I've got some suggestions around how you could do that.
Okay. Yes. All right.
What's working for the appraiser and what could they consider doing differently? Think about the point at which we've stopped the action. Who's doing the work in the conversation? You might be familiar with the coaching continuum or push-pull model. So the push end of the continuum is where the coach is solving the other person's problem for them. And the pull end is about helping somebody to solve their own problem. Neither end is good or bad. Both can be helpful depending on the coachee. Here are some of the behaviours you might see from a coach depending on where they are on the continuum. Let's rejoin our appraiser as he attempts a change of tack, using more of a pull style. Okay, so we've discussed the fact that your career's going really well.
Yes.
You're spending a great deal of time away from the trust. We've talked about the multi-source feedback and the fact that your team are reflecting that there's some strain being placed on them as a result of your absence from the trust. That's been a surprise to you. And you've expressed some desire to do something about that and also to look at your post-op complication rates.
Yes. Yeah.
Is that right? Is that a fair summary of...
I think that's fair.
Yeah, okay. So I suppose the question is, it's the so what question. So what are the options in terms of starting to do something about this?
Well, funnily enough, my PA has been badgering me about spending a little bit more time with her, actually, to help her to manage my diary, which we are not staying on top of at the moment.
Right.
So I think some difficulties are arising because of that lack of communication between us. So finding time to sit with her, I think, would be valuable.
Okay. How might that play out? What might be the upside of you spending that time with her? Because I imagine you're going to need to justify for yourself the time to sit down with your PA. So what's in it for both of you?
Well, I think she spends a lot of time trying to get hold of me and being a little frustrated when she can't, because I will occasionally insert activities into my diary that I won't necessarily tell her about. So I think we need to talk about the regular items in my weekly schedule, make sure we've timetabled those and ensure that we have a means of catching up throughout the day, so she's not trying to get hold of me when I can't pick up the phone.
Okay, great. So that's an option. I'm wondering what else you could do. What other thoughts do you have? So the appraiser has shifted their approach to what you might recognise as more of a coaching style. Discuss your response to this and decide when you think a pull or coaching style might be most helpful during an appraisal conversation. Also consider where you spend most of your time. Now let's hear from our doctor. How has this section of the appraisal conversation landed with them?
I'm actually getting a lot from this conversation, which I didn't expect when I came into the room. I have never been challenged in an appraisal before, and actually these questions that are being posed are making me think, probably for the first time, about the levels of patient care that I'm giving, about how I'm communicating with my colleagues. And I feel it's very fair, the questions I'm getting and the comments, and not judging in any way. So I'm very happy to engage with this. And I'm actually enjoying having the time to talk about the work that I do and what matters to me. So hearing some feedback from colleagues, which I don't generally get, and being challenged on my practices, I think is a very healthy place to be. I mean, going back to the feedback, I found that quite shocking, if I'm honest. So I would like to talk to my colleagues about that. I have no qualms with talking to people directly. Mm-hmm. So I'd like to get a little bit more information from them around their thoughts about that. So I'm quite happy to call a meeting with my surgical team.
Okay, great. What I'm wondering what your considerations might be around that. You know, what we've talked about so far is there may have been a reluctance, or maybe.
Well, I think it's more a time management issue, actually.
Okay.
From all of us, you know, I'm not the only one that's busy. To be fair to them, so we will need to timetable something which is workable. It might mean splitting the team, and we don't have one big meeting, but I catch up with a group and then a few individuals possibly. Yeah. If that's what I have to do.
Okay. All right. So spending some time with the team, setting some time in your diary to have some conversations with them about how you can work better together. Is that?
I think so, and I think my PA will be able to help me timetable that and stick with it.
Okay. Very good. Anything else that you think you could do that might make a difference, might start to remedy this?
You have made me think more about my complication rates, which are safe, and you know I understand why they are the level they are, and yet I think they can be improved upon, and I think that with my increased contact post-op with patients, that may help to lift those figures, or reduce those figures, I should say. So it's looking like I need to spend more time in the trust as a general principle, and take less commitments elsewhere, which, although are tempting, are eating away at the time that I do have.
Okay. And it might be about finding the balance there, because I absolutely appreciate the upside and the temptation to go away and to do that work.
Yeah, I'm not doing it for my own glory. I'm doing it because this field is very young, as I've said, and there's a lot of shared practice which is taking place. So it is really important that I'm at the major conferences. So it is a balancing act. Yes.
You mentioned patients a couple of minutes ago. What about your responsibility to your patients? Where does that sit?
Well, they are
within
paramount.
What we've discussed?
Yeah, they are paramount. So I think, and possibly I have forgotten that. So yes, I want to follow up on patient care a little more.
Okay.
Have more direct communication with my patients, quite a few of my patients know the team better than me just because of circumstance, and I think I should work to change that.
Okay.
Actually.
Okay. Sounds like we've started to generate an interesting list of options.
You've
there.
given me more work to do thinking
Yeah,
about this. So, but no, it's good, and I enjoy the challenge of it actually.
Okay.
So this is good for me. This is good for me to have a look at my current practice and see what positive changes I can make.
Okay.
So no, it's all good.
Good. And to be a little bit more provocative for a moment, I suppose the risk here is that we have this conversation, it feels great, and then you go straight back into the real world and events take over, and before you know it, you've run out of time to put into practice some of this stuff. So how are you going to make sure that something happens?
Well, I mean, I have a PA who is on my back constantly at the moment, so she certainly won't let me forget a meeting with her,
Okay.
and fairly so. Fairly so. No, I make a commitment to you that I will follow up on this meeting, and when I say I'm going to do something, I do it. So rest assured.
Very good. Any support you need from me around any of this?
No, not at all. I think you've made your voice very clear, and you've helped me to gather my thoughts. So thank you, actually.
Okay, very good. Shall we start to move on to look at your PDP now?
Yes, indeed. We've probably got a lot of fodder there for it now, haven't we?
I think we probably have.
Finally, based on your discussions with your colleagues and what you've learned through watching this film, what are some helpful ground rules or tips for these conversations?